Hello and welcome to a brand new episode of Cabbie Conversations. I'm joined here by my friend James and Phoebe. Hello.
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 And today we will be discussing plastic surgery or cosmetic surgery. So I wanted to open up the discussion by asking you both if you could change one thing about yourself with surgery, what would you change? James, go.
I would like to be quite a bit taller and maybe have feet that aligned with that, just proportionally bigger. Being only about 5 foot, just under 5'7", it would be nice to maybe hit 5'10".
Can they actually do that? Can they do that? Can they like stretch your spine out or something?
If you're a teenager, you can take like growth hormone, and that can like increase the potential height you can be. If you're a dwarf, you can also have surgeries as a dwarf. This is all while you're a teenager, before your growth plates are fused. That basically breaks the bone like a tiny bit and then leaves it a bit further apart, so the bone then, like the bone as it's repairing stuff, reaches just to like mesh together, and then that over time makes you taller.
Whoa, crazy.
But that's very painful.
Yeah, sounds it, but yeah. What about you, Phoebe?
Probably just get my nose fixed.
We were discussing this, but like nose jobs seem to be like the most common thing for girls specifically. I'm not wrong about that, right?
Yeah.
It's like
Probably.
It's really weird to me though, because first of all, your nose looks fine.
Yeah,
and second
I was like, what?
It makes
no
sense.
It's horrible.
But
I hate
every
it.
girl, I feel like, again, not every girl. This not
They
speaking.
want to look like Voldemort.
Yeah, that's exactly what I said.
Not quite. I want just like a cute little dainty nose.
Yeah, but then you get a cute little dainty nose, then you look like Michael Jackson. You want to look like Michael Jackson, like a ghoul from Fallout? It's not. It's not gonna look good. It would not.
Gollum nose.
Yeah,
look Gollum nose.
Or maybe just like sort my jaw out, because my teeth are all like misaligned and it sets my jaw off. But I guess that's more of a dentist thing. I mean, I had braces and they just couldn't fix it, because I think it's like more my jaw structure than a teeth problem, maybe. I'm not sure.
Yeah, I had my overbite was really big when I was younger, and I had crooked teeth, so I had to wear these like big block things that realigned them.
Yeah, I had a massive overbite still.
I had a very traumatic experience with braces.
Yeah.
I had braces for 8 years. Okay, 2 different orthodontists. The first orthodontist, after the widening was fine, didn't mind the widening, but basically it was like an all-in-one retainer which had like fangs that stuck into your jaw and brought your jaw forward and clenched it, so you couldn't talk, you couldn't move your jaw while you talked. Your jaw was fixed in place, and it was really painful. I've still got like scars like where it's gouged into the bone in my jaw. It was I couldn't, like, because it was really painful, I used to take it out in my sleep and stuff, because I literally couldn't comply with this method. So my orthodontist glued it into my mouth, and then I couldn't eat solid food.
That must be illegal or something.
It was. I'm not joking. It was horrendous. It was horrendously painful. I had blistering headaches, migraines, backache, neckache, the works. And eventually, my mum was like, after like 4 years of this ordeal, I also would keep breaking it because I put it in my pocket because I didn't want to wear it and then fall over and break it. After this like ordeal, like my mum eventually was like, this is like barbaric, isn't it? I was like, yes. She's like, you never have to go back again. And then we had a much nicer orthodontist, which actually fixed my teeth and didn't hurt at all in comparison to that.
Lovely. I already know that this episode is going to make me so uncomfortable, and I'm glad to know it's already started.
But now you have really good teeth, so it was worth it.
Yeah, I mean that one wasn't, but
you still could have skipped the first 4 years.
Yeah, I mean, what about you, Ed? What would you change if you could change anything?
I would take all the hair that's not on my head and put it on my head. because I'm beginning to bald slightly, not that much, but I'd love to be able to just be a nice smooth man and then have all the hair that's from my body on my head.
Get rid of those hairy toes.
Yes, hairy everything, hairy back, hairy arms.
Imagine having toe hair on your head though.
All right, the toe hair I'll leave behind. But like the arm hair and stuff like that. Pubic hair as well. Too much of that.
You want it on your head?
Yeah, I want that on my head. No, I don't. I'll get rid of that as well.
Big replacement.
And I just love to not have to like shave every day as well. That would be nice. But yeah, because I don't like being a werewolf man that much.
No, but Ed, the fact that you're a hairy man means you're a very manly man. That's what it means. It means you've got lots of testosterone coursing around your body.
I would feel a bit better about that if it wasn't like chest hair, yeah, but like back hair is not exactly what people want. They look they're all like curly and sparse and like it's not nice.
You do start I've got a few random black back hairs like right in between my shoulder blades, and I'm like, how the fuck? Like no back hair anywhere else, but just like 5 random back hairs just appear.
No, they're like back pubes, honestly.
They're long and black. And like, what the fuck?
We're just being real. Come on.
They're really hard to tweeze out too because you can't really reach them.
I just shave them.
Oh no, but then it'll grow back and stick.
Yeah, but what's the alternative?
Tweeze it.
Wax it off.
Wax it off. I don't have wax. That sounds painful.
I'll wax it for you. Don't worry.
I don't want you to. Also, then it's like if you shave, you start shaving like your body. You have to sort of shave the whole thing because you can't have like one smooth bit and one hairy bit. You know what I mean?
You can shave your toes, man.
Alright, fine. I'll shave my toes. Right. That's a conversation.
You don't have to. I'm joking.
I like my hobbit feet. Okay. Fuck's sake. Well, now that we've given a thorough expose of our innermost insecurities, that leads us nicely onto the main topic, which is cosmetic surgery. The ethics, the pros and cons. James, what is your opinion overall on cosmetic surgery?
Overall, well, I think I want to start off with explaining the difference between cosmetic and then plastic surgery, because they're not the same.
Mm-hmm.
So cosmetic surgery is surgery which changes the appearance of a tissue. It's purely for aesthetic reasons, whereas plastic surgery is often a reconstructed procedure. So for tissue that is missing or damaged. So cosmetic surgery could be something like nose reshaping or like female breast reduction or even male breast reduction, which is caused by something called gynecomastia. Whereas plastic surgery, these are all procedures that are available on the NHS if you so desire to check them out. Whereas plastic surgery is available on the NHS due to things like having like a cleft lip or palate, which is like a birth defect, having webbed fingers and toes, which is when like they're like fused, the bones are like fused together. I've actually seen the surgery for that. It's really cool. And then like having birthmarks or removal of like a cancerous tissue, which could have like obviously change the appearance of like say like your breasts or like your face or something, and then like that would have to be reconstructed. Yeah.
Now you said something interesting, like they're obviously available on the NHS, but they obviously don't provide any strictly medical benefits. They don't increase your survivability.
No, they provide cosmetic surgery if they think that the thing that is causing it is causing significant distress.
Mm-hmm.
So with like for example, breast reduction. If a man has boobs, that's like not considered particularly normal within society, and he would probably get bullied, or at school he would get bullied for it, and you'd be incredibly self-conscious of that as an adult, and it would probably limit your access to spaces like swimming pools and gyms and things like that. So it would make sense for if a man wanted to have a breast reduction, and if a woman wanted to have a breast reduction, having large breasts as a woman can cause back pain. It can also mean you get a lot of attention you don't especially want from men, and that can also be exhausting to deal with. So there are times where cosmetic surgery may be important.
I know a lot of women get breast reduction when they're like older and they're married, because there's no real reason to have it anymore, I suppose. But yeah, you're right. It's like it stops getting as much attention. But so Phoebe, what do you think in general?
I don't know.
Well, I suppose the question is do you think that do you think that people should be allowed to sort of make this choice to change themselves in the first place? Even though that should be an option on the table?
Definitely.
Mm-hmm. How come?
Especially if it's affecting your life.
Mm-hmm.
I don't think, well, if it's just an appearance thing, maybe it shouldn't be available on the NHS, but that's the way it is anyway. So
even if it's purely appearance, but say it's a burn victim or something, and they were
oh no, that's not what I mean. Just you're unhappy with your nose, so you want a nose job, that shouldn't be available in the NHS. But if you're a burn victim, then definitely.
Where do you draw the line? Because someone could have very severe what's that?
When it's severely affecting your life, a burn victim, it might not be completely aesthetic. It could be to do with discomfort as well.
What if you had a nose like the Wicked Witch of the West? Would that be severely affecting your life?
Probably not.
I feel like it would. People would not be, like James said, you get bullied at school and everything.
I don't know, I'd get it if you'd had a broken nose in the past or something, and it was sort of preventing you from breathing properly. Maybe then, yeah.
You're saying if it was an injury or some medical problem
or
that
just
caused it?
Anything that's preventing you from breathing. Do you know what I mean?
Yeah, that's fair. That's fair. I suppose the thing is, for me, I suppose I might sound a bit hypocritical, because on the last episode I said people should be allowed to basically make their own choices and stuff, and I still do agree with that. The problem I have mainly is that plastic or cosmetic surgery, in most cases, is a way of essentially band-aiding society's problems, which is the fact that everyone is so obsessed with looks. And certainly I certainly can't empathize with people who have but burn victims or some people with serious visual cosmetic issues like that. So I can't exactly speak from experience. And a lot of the times, they end up being a lot happier afterwards. But I can't help but feel like the problem isn't with how they look, it's with how other people are judging them based on their looks. I don't know, would you agree with that?
I would say I think that it depends on the root psychological cause for wanting to make this cosmetic change. If it's because society, there are considerable benefits within society being more attractive through psychological studies. People perceive more attractive people to be healthier, wealthier, more trustworthy, more intelligent than less attractive counterparts. And this is especially like I mean, as men, we don't really have so much. This is not necessarily so much, doesn't impact men as much, but for women, this is a big deal. And women who are more attractive are more likely to have marry a more wealthy partner. So there's a lot of social mobility. Less so today, but the stigma, like, you know, the history of this and like being is still there. So for women, there is there's a lot of social mobility and like positive like life benefit to being more perceived as more attractive. And
I agree with that. My problem is that I don't think that's a good thing.
I don't necessarily think it's a good thing. And I think if you want a cosmetic procedure, it should come down to like, well, why is there like a underlying health issue with it, or is it like a mental health issue? Because I mean, having cosmetic surgery, you are technically, if you are a healthy person, you are technically going in and damaging healthy tissues. You're actually you're actually damaging your health. You increase your risk to things such as like blood clots, collapsed muscle, chronic pain. You can even, if you use like Botox and stuff, you increase your risk to paralysis, facial paralysis and things like that. So there is risk that comes with these procedures, especially if they're done by some, you know, dodgy doctor around the corner, you know. On the
LA doctor.
Do
you think that people with a very severe like mental illness, like depression, even if the plastic surgery or cosmetic surgery makes them happier technically, do you think that's like a good thing? Because to me, that's sort of not really getting to the root of the issue. Like, you're basically you're treating the symptoms rather than actually, you know, helping them deal with the actual depression or mental illness.
Yeah, so that basically the disorder is called body dysmorphic disorder, and it's a distorted and distressed perception of one's own appearance. So you might look in the mirror and think that your nose is a great bulbous schnoz when it's actually quite neat and tidy, or you might think that your gut just absolutely hangs all the way down past down your flies when it really probably doesn't. You can have these procedures to change what happens, but often if you have body dysmorphic disorder, the procedure won't give you the desired effects you desire. So that leads you then to having a more severe surgery and a more severe another procedure after that to kind of keep changing what's insecure. Your insecurity might shift to another part of your body. So I agree, it doesn't mask it moves the problem about. It doesn't get to the core problem, which is an internal feeling of insecurity.
So what's the solution to that then? Are you saying like you could make some form of therapy mandatory if you want to get any sort of cosmetic surgery?
I think doctors should ask like why they want to have the procedure and try and get to the root of why they want to have the procedure before they just simply say, yes, you can have it. And some doctors, many good cosmetic doctors, if someone's had multiple procedures, after a while they refuse to treat them anymore. They say, no, I will not treat you anymore. There is something else going on here, which I think is ethically sound.
It's only ever going to be some though, isn't it?
Really.
Yeah.
It's a business in the end. Like,
yeah, that's exactly what I was going to say.
Well, I think
No, go on.
If the doctor does not act ethically, then they can be, struck off for malpractice. So it is in their interest to act ethically. And also for their patients, it's also important to act is important to act ethically. But yes, it is a commercialized business, and we live in a society where what you look like makes a massive difference, so they can totally capitalize off it.
I think that's my biggest problem.
Is there a regulatory body for it?
That's a good question. James would probably know. Is there a regulatory body
for cosmetic surgery?
Yeah,
I don't know.
Or maybe some charity that offers help. Maybe, I'm sure that exists as like an alternative. But because a lot of these problems come from, like you say, the body dysmorphia, and
yeah, there is for the UK.
Oh, there is. Okay, well there you go.
Cosmetic product regulations.
Interesting. So, like, you know, ultimately, like, what it comes down to is these. I feel like a lot of these problems start when people are younger, particularly girls, and like, it's very hard to shake that, feeling of body dysmorphia. In fact, I don't think it really ever goes away fully. You're always going to like compare yourself to other people, and
I still think I'm fat. I know I'm not, but I think I am.
Yeah, it's like there's two levels. On an objective level, you're not, but you can't help but feel that way.
Yeah.
You're not fat.
I don't think like high school environments help.
No, definitely not.
Especially for girls. I don't know what it's like for guys, but
it's definitely worse for girls. I think there's a slightly more pressure on guys to be like bigger and whatever, but there's very much more of a pressure for girls to sort of be like wear makeup and have big tits and like be tall and stuff.
Have that tiny little waist.
Yeah, little Barbie doll waist.
Yeah. There's a definite pressure on girls to take a keen interest in their appearance. And if you don't have a keen interest in your appearance, you're sort of treated as you're seen as quite unusual. And then like why are you not excited by the concept of makeup and clothes and things like that?
So that's an interesting thing. If we were looking at, I suppose, or if I was to play devil's advocate, you could argue that, well, we allow people to wear makeup because on some level it makes you feel prettier, which isn't necessarily a bad thing. You feel more self-confidence in yourself, and that allows you to be more productive and all that stuff and just be happier in general. So realistically, cosmetic surgery it fulfills the same role. It's one less thing to worry about, I suppose, which obviously then enables you to do other stuff more productively, be happier with yourself. So if you're looking at it that way, could we potentially justify it?
But would a society with no makeup and no cosmetic surgery be a better place? Where there was less emphasis on your appearance?
Yeah. I suppose it's hard to imagine that society because we're so ingrained with it.
It's a very ingrained society. I mean, like, appearance is almost part of sexual selection and looking for partners. So it's like ingrained into us evolutionarily.
Yeah, it's almost not. It's not like a human invention almost. It's biological.
So, I mean, what society decides is attractive is a social construct. But looking for somebody who we perceive as sexually fit and a desire to mate with, that is ingrained within us as a species. So if we could change, because I think people are always going to be people are going to be naturally attracted to things. I think that's just the way, but if we could change the way that society, what we deemed as attractive within society, and maybe take less, and I think a lot of like fashion companies and stuff are trying to do that with, being more body inclusive with like models of different sizes and stuff, we could therefore change the potential desire and pressure that people experience, and therefore the need to have cosmetic surgeries. But I don't think we can't change attraction. Attraction is a raw life force.
Yeah. I suppose, what about people whose basically job it revolves around to be attractive, like models and actors and stuff? Do you think that they have a sort of more of a legitimate claim to be able to enhance their appearance?
No.
Why not?
Because they're basically the poster people for humanity. They're like the people the media, present as humanity. Go, these are worthy humans, and to say that you're only worthy if you're beautiful is pretty dehumanizing to everyone else. And it also massively objectifies those people and then makes them incredibly insecure about their own appearance, because they're often well, we have a friend who's a model too, and he says he notices the effect, the like touch-ups and stuff that people do to his on his photos and stuff, and that affects him.
So imagine if like you're presented with this goal of a person and it turns out that they've just had a shit ton of surgery to look like that.
Creates a very unrealistic standard.
Yeah, and then everyone's got problems.
No, I agree completely. I think it's probably a topic for another time, but I think the modeling industry is a very immoral whole practice. But in particular, just the way, you inherently try and like compare yourself to them. An interesting thing I like to do is on an average day, try and not comment on the way something looks ever. And it's surprisingly hard to do because human beings are so, even if it's not necessarily about like people, it's very common to sort of be obsessed with like how things look, if they look appealing or attractive. So that extends, I think, to other people as well. So, but once I think there is a way that you can sort of differentiate, like, being able to identify that someone who has had plastic surgery, they're not really attractive in the same way. Like they've basically cheated. They entered the cheat code for being attractive. Like it's not really authentic, at least not to me.
I think whether or not you find cosmetic surgery attractive or not, cosmetic surgery will never have the same finished result as somebody who, say, has a desired look naturally, because surgeons and medicine just isn't that good. You can't change that.
You think it will be that way in a few years?
No, I don't think surgery will be effortless. I think scarring, things like scarring will reduce, things like that. I think, well, if you look at cosmetic surgery in the 80s, which had there were some right shocking results in the 80s. The start of cosmetic surgery, and you look at it now, there is definitely a lot of it has got a lot more. There are a lot less botched jobs, if you like, but at the same time, it's still never good. It's still not going to. It's just not a natural effect.
Yeah.
But again, if somebody chooses to have cosmetic surgery, it's because of their own. It's often because of their own deemed insecurity. So in a sense, although I might not agree with cosmetic surgery, that doesn't mean I should be dispassionate to that person for choosing to have it.
No, certainly not. I mean, I can't really understand that want necessarily, but it's certainly not their fault for wanting it. They've been placed, they've had an idea placed in their head, basically, that they need to look a certain way. And it's very sad because it's not necessarily true.
No, I think something that's quite sad about, so body dysmorphic disorder is found in roughly about 2% of the population naturally occurring. This rises to 15%, up to 15% with those who have chosen to have a cosmetic procedure. But those who have had cosmetic procedures, those who do have BDD and have then had a cosmetic procedure are an increased risk to suicide, and that's found across multiple cultures. So it is a very real form of human hardship. It is a very real psychological disorder, and I think people can be quite dismissive of the pain that is there and just misconstrue it for pure vanity.
Yeah. That's something that's very common with like eating disorders as well. It's like you'd think that their only real incentive is to, like, you know, be thinner to be more attractive, but psychologically it has a lot more to do with like feeling low about yourself and like basically self-flagellation. It's almost like punishment for yourself.
And
yeah, go
being
on.
in control of your actions.
Yeah. And that's, to an extent, is true, I think, as well with like body dysmorphia. It's sort of a weird feeling that you don't, well, you need to look better. It's like a very low opinion of yourself. It's not like thinking that you deserve to look better. It's the feeling that, like, oh, you need it. It's very, very difficult.
But it is noticeable when you do have a cosmetic change that you do get treated differently. For example, when after I had braces, I noticed that people were instant, and I got my braces off, people were much friendlier to me. There was a very real placebo effect of there were very real positive, tangible that of like being perceived as more attractive. I noticed the moment I got my train tracks off, people were nicer to me.
Maybe you were just being happier.
Yeah, that's a good point.
Because that's what I put it down to. Like, I like refused to smile when I had braces. Like, I just kept my mouth shut, and as soon as they came off, I was like the happiest person ever, and I'd talk to anyone and wasn't ashamed. Do you know what I mean?
It's like inward out.
It could be either way, but I think it was because I was more likely to make an effort to talk to people because I wasn't so shy.
Oh,
that's an interesting. I mean, yeah, and that could be true, and that could be a definite pro of a cosmetic surgery. It makes you feel more self-confident, but I guess it's working out where the line is between self-confidence and self-loathing.
Well, you just mentioned like braces, and I feel like a lot of people wouldn't really think about that kind of stuff in terms of cosmetic surgery. So yeah, you mentioned braces, and obviously like there are other aspects of cosmetic surgery that people might consider, myself included, more sort of quote unquote legitimate or ethical. For example, you know, surgeries to make people look more like the gender they want to look like if they aren't happy with the one they have. Yeah, would you agree with that? Do you think that's more of a legitimate use of medical time and effort?
Well, braces aren't just purely cosmetic reasons. Having braces makes your teeth easier to clean, so therefore reduces the chance of cavities and gum disease. So that's actually quite beneficial to your health to have straight teeth, as well as it having a clear cosmetic advantage. I guess something else you could like bring up is like acne, because acne won't kill you. It's not like a lethal disease or a lethal condition. It doesn't really decrease your physical quality of life or health or anything. But it can have quite big psychological consequences, you know, children calling each other crater face or
My brother had
or
acne. It didn't look, yeah, I can imagine it's not like the nicest thing.
so I think, again, although it's not like a life and death situation, but would it make maybe somebody feel more confident if they didn't have acne? Yeah, it would.
No, that's fair enough. Again, as you definitely can't blame the people for wanting this. I suppose in principle, and perhaps I'm being very naive, I would just like for people to not worry so much about what they look like and not worry so much about what other people look like. Because there's a lot more important problems going on in the world. But that is only my wish.
But there are social consequences to your appearance. For example, even like, as we were discussing, like height in like the introduction, taller men on average make more money than shorter men.
Really?
Yeah, and although that's a purely superficial thing, it has real life consequences. Because the taller man is seen as taller, more assertive, more almost, I guess, more like, yeah, more dominant. So therefore is accredited with more leadership roles, maybe, which then have more respect and get paid more.
I was thinking as well, it's not necessarily related to like, well, I suppose it is. Say like stuff like piercings and stuff and tattoos. You could almost consider them a form of like, it's not a cosmetic surgery, but it's sort of a cosmetic enhancement.
No, I just found them.
Exactly, that's what I was going to say. It can be a form of, it's not necessarily like you feel like, oh, I need one to look pretty. It's more of a form of like self-expression, you know, expressing that like a certain style. And in a weird way, yeah, it occurs to me that I feel very differently about that compared to like, you know, getting a boob job or something. Because I suppose in some ways, getting plastic surgery or something is a weird way of self-expression. It's like how you personally want to look. It's just a shame that it's affected by so many societal, you know, it doesn't come from nowhere, basically. Society tells you that that's what you should be looking like.
Well, tattoos also can have like a societal, I mean, historically they had societal meaning. You know, in Maori culture, I probably get this, but it's like a symbol of like a warrior or your spirit animal. It was like in like American and I think British culture, it was to do with sailors and like where they'd been and how many voyages they'd survived was to do.
It's almost a status thing, isn't it?
Yeah. So tattoos almost, they do have a social status, but in a different way. But I think that again, social body mods can be interpreted into sort of can be part of body dysmorphic disorder, because you see individuals who have like horns inserted into their heads and their eyeballs are tattooed, which can make them go blind, and their tongues have been split and things like that.
Yeah, that's like, no good.
I mean, surely, I mean, to the point where they don't really look human anymore. And to me, that must signify some form of psychological distress.
Yeah.
The need to look so, for there to be a need to look so very different. So some tattoos, yeah, I mean, some tattoos, some piercings, all for freedom of expression. But when does expression of like individuality become expression of distress?
I don't know. That's an interesting thought to leave on. Do you guys have any final thoughts? Well, I would just like to say that everyone listening is very pretty and they don't need to get plastic surgery.
Agreed.
Except for me. But that's all we have time for.
That's
this
not
week.
how the rule works. That's not how it works.
It's all for me.
You just undermined the whole argument.
I was thinking, it was just one last thing. I was thinking the reason why I think plastic surgery creeps me out is the whole uncanny valley thing, because they still look human, but they don't look as human, you know what I mean? Like they look slightly off kilter. And that's a lot of reasons why you find something scary.
Botox and stuff, because it paralyzes lots of nerves in your face. Basically, especially if you have something like lip fillers or things to make your cheeks look bigger and things like that, or to stop wrinkles in your forehead. It basically, because it paralyzes the muscle, how your muscles move, it basically limits your facial expressions. Yeah. It means that you can't express your face so freely as you like before, and so that can create a sort of like robotic or almost doll-like appearance, because they haven't got the flexibility in their face that somebody who hasn't had those procedures would have, and that's why it can be a bit unnerving.
I'm sorry, I'm not judging anybody, but like that stuff really creeps me out when you see people that just like can't stop smiling, basically. Oh, that really disturbs me.
Botox does have lots of other uses. It can be used for people who have like muscular issues and things like that, and like have spasms, and it can help limit things like that. So Botox in itself is not completely bad.
Yeah.
There are other help. There are times where Botox is incredibly useful.
That's very true. Well, very thought-provoking. Thank you very much, everyone, for listening. Goodbye.